each of slice has different colors.
It symbolizes
orange.
Race.
Orange.
Race. Orange.
Orange.
Orange. Why?
orange.
Well, each of each slices have different colors.
Yeah.
So it's heterogeneous. Does it make sense, right?
Yeah.
Hello. Hello everybody.
Hi.
I'm Hoyoung.
Who are you?
I prepared some medical case.
Oh, medical?
Medical case.
Oh.
So we will solve the case together.
So your
But actually
Is it surgery case?
is it your own your personal case you met during your rotation? No.
From bibliography. From bibliography.
Bibliography?
Yeah, when I prepared this presentation, I was a little worried about freshman because it contains many medical terms and medical need some medical knowledge, but I didn't put some many explanation for this. So.
But there's no freshman.
There's no freshman.
But Mitch is much knowledgeable than
I'm not a freshman either.
He is
I'm
fourth year.
yeah, he's been with
Mitch
us
has
for years.
so much knowledge in medicine.
I learned a lot. Yeah.
Do you think you learned a lot here?
Maybe. I
Really?
learned.
Maybe.
I
We're
learned.
not sure.
I learned a lot. I forgot a lot too. I learned a lot. I learned a lot and I forgot a lot.
So let's start. One day, my mom came to
His style.
the clinic. She's a 46-year-old woman who presented with 24 hour history of abdominal pain. They began approximately 1 hour after a large dinner. Do you understand it?
Yeah.
Me too.
Oh,
She overate.
Too much eating.
maybe. And her chief complaint is the
She's still. She's
pain,
bored.
epigastric pain, but it changes to light upper quadrant pain. And the
Just
character
below the right gallbladder.
around
Right
this
diaphragm.
around this area, and the character of this pain is dull. And ROS. She has some nausea, but no vomiting. And after some time, the pain has improved, and she has some history of similar episodes of pain
Doesn't look
in the
very
past, but it was self-limited. It was self-limited again and again. And she has
her
type 2 DM.
Abdominal pain.
After some physical examination, you found her vital signs was okay, a little fever, 38.1 degrees Celsius, and but other vital signs are normal. And her abdomen, no distended with minimal tenderness, REQ, and like I had exam from that exam, there is no abnormalities.
Was Murphy's sign positive or negative?
Noted.
Wasn't it practiced?
Or little. Because now this time at the time pain has diminishes.
Diminution.
So what will you do now?
NPO.
So but you have to diagnose the disease, so you have to do something to examine the patient more.
Multi-sign
Probably
test.
do all multi-sign test and
CT.
maybe multi-sign is a bit positive.
Weak positive.
Probably do.
I think CT is required.
I didn't see it.
Ultrasonography was
Ultrasonography?
less invasive for more.
I call 109.
You're a doctor, you have to solve this case. So other things, imaging studies.
How about lab? Have he had the lab test, the blood CBC?
No, you can do that. Really. You want to do some
Okay.
blood test?
WBC
Yeah,
level.
I want to see the
CRP.
CPR. Resuscitation.
I did CPR
I
many times
cried.
in
I
PR.
cannot do that. I
So
studied for
why
years.
do you
but I
want to
cannot do that.
do lab test? What do you search for?
Amylase, ALP, or gamma
Gamma-GT.
I give an EpiPen right to the heart.
Wow!
That work.
Yeah,
That
that
work.
will work.
Take care of the phone.
And so, yes, you're right. And we can do lab test and imaging. Actually, I
like the
heard that
pictures.
in emergency medical care center, this is a routine job. You can have some information from this. From that test, WBC won 13,000 dollars.
It increased.
a little increasing.
Yeah, a little increase. And from serum chemistry, total value
where did
1.8 milligram per deciliter. It was normal. And directed bilirubin was a little high, but ALP and ALT was in around the normal range.
Is it? Oh, I'm sorry. I didn't see the complaint in the first case. So,
Complaint was abdominal.
so it is abdominal pain in a patient with diabetes. Is it all?
Yeah,
IgD.
So it's first episode or second episode?
Maybe recurrent.
So how many years
Recurrent episode.
since he or she was first diagnosed with
Maybe
diabetes?
diagnosed.
10 years or 15 years? Maybe. Because if it's really a complication of diabetes, it would have been more than 10 years like that.
Please explain.
We don't have information how many years.
I don't know about
she-
that complication of BM.
I'm not sure which complication, what kind of complication it is. How about physical examination?
Past
No, current physical examination. Any bowel sound or gastric sound?
no, it was normal.
This was
Liver tenderness sound?
and she has acute pain. At first it started as epigastric pain, but it moved into acute region.
Oh, first she had
Epigastric pain or discomfort, but it changed it into acute pain.
Anyway, you already have an answer, right? Don't you?
Maybe, but I think there is a possibility. Maybe there are other options.
Well, talking about their GI complication with diabetes, not many, I guess. It's not infection, but it's possible that gastric pain comes from diabetic.
I think diseases too
Yeah.
different. Okay.
So what can you think of?
Diary gossip.
Diabetic gastropathy.
I think cholecystitis.
It's kind of autonomic neuropathy.
Yeah.
So it
Can
does
be
not
possible.
cause fever usually, but if it's a real case, it's possibly it's just because concurrent just cold, common cold, and plus
Yeah, yeah.
gastric problems.
Mhm.
Because we are not sure she also had the fever in the past episodes.
She has a history to overeat because after she had a large meal, her pain restarted.
So it's
So
likely
I
that is
guess
related
it's
to
cholecystitis.
what's that? What's that? What infection?
Not infection. I think I just guess she came down to cholecystitis or similar problem.
Colitis?
Maybe colitis.
Colitis?
But ulnar region
Their location
is
is
rarely associated with
with the
colitis.
infection.
Maybe
There's
maybe
part of colon here,
gallbladder
but
or
not usually.
pancreas or stomach problem. I think.
So
Cancer.
Right upper
Stomach
quadrant.
I think most likely bilirubin is normal.
Okay.
How about
go on.
pancreatic labs?
pancreas
Gallbladder problem.
feels normal. How about let's go to the
E.
next
coli.
slide.
Let's move
Yeah,
to E.
next.
coli.
Very nice.
Now lab test, it was amazing.
Imaging test. Okay.
So,
There is an
We
error.
did US.
Gallstones?
Yeah. And we
Gallstones.
found
Yeah, I totally got
stones
You did,
in
yeah.
the GB. And GB wall was thick and common by doctors.
So
Dilation.
They were diabetic. Not
Hey,
diabetic.
so-
It was
a
so diabetic.
what did you?
Maybe.
But the gallbladder wall was thickened.
So you
So
mean
you-
common bile duct size is normal?
And you didn't say any and you didn't
All
see
the-
any
all
diabetic.
you didn't see any sludge in the bile, right? Like
But there was stone.
Yeah.
the stone without sludge.
So
Oh, sorry.
the diagnosis. We
Malingering.
found stones.
Neurosis,
Why?
neuropsychiatric
Schizophrenia.
neuropsychiatric problem.
Schizophrenia.
Well, because we found GB stones, so
Hypochondria.
we can
Hypochondria is possible.
actually we couldn't set the diagnosis.
Yes.
Okay, cholecystitis with
Yeah.
gallstones.
Oh,
Because
that's right.
I have presented this topic last year.
Oh.
So what?
But yours are more excellent.
But actually, maybe it could be chronic because she has some similar episode.
I don't quite remember, but this ALP or gamma tributary usually doesn't include with cholecystitis.
Actually, acute cholecystitis, the symptom trial was mild fever and mild leukocytosis.
So stones are just localized in gallbladder, not obstruct. So bile duct is not obstructed here.
It didn't cause bile duct.
In this case, the bile duct was not obstructed.
I'm thinking of too difficult
Because
diagnosis.
the size of common bile duct was normal.
And question number 2, what is the best therapy for this?
Surgery.
Wow.
Cholecystectomy. Just
That's right.
remove the gallbladder.
That's right. Laparoscopic cholecystectomy.
That's therapy.
You can't urinate them out like the other ones.
But I don't remember
Kidney
the
stones you can urinate.
Well, while leukocytosis is connected to your bowel, maybe you can poop and not urinate it.
That's maybe more comfortable, I guess.
Maybe you can. I think it's possible to poop the gallbladder.
Really? Don't put the gallbladder.
Maybe it sounds convenient.
Is there any lithotomy? Can I say?
Ultrasonography
Machine?
stone destructor.
Yeah, because the urinary stone can be removed by
There is.
ESWL. Yes.
Really?
Yeah.
They have a machine?
Yeah, it can be
Extracorporeal.
destructed sonographically.
Oh, I didn't know that.
Ultrasound.
Wow.
But I never heard it was developed for.
It is not indication of
Yeah, it's possible, but it will recur soon, so it doesn't make sense.
So
As I know.
people with GB stones, they have some tendency to make stones. So maybe if we
There's some problem in gallbladder.
if it disrupts the stone, but then in the future
they will get another
okay.
stone.
So usually there are not many stones if you see gallbladder, not that big.
I saw just tiny stones in gallbladder when they were removed. So anyway, it is effective, more effective to just how can I say? Remove the gallbladder. The place was removed.
And
is removed.
in these days, laparoscopic method was commonly used. But this, to do the laparoscopic cholecystectomy, we just cut the stomach in just four places, sites. So there is one for each.
1 cm or 2 cm?
Around 2 centimeters. It will be more beneficial for cosmetic purposes.
Only small incision is required.
And the skilled surgeon has the similar outcomes between laparoscopic cholecystectomy and laparotomy.
Open surgery.
Yeah, open surgery. And question number 3. What are the complications associated with this disease process?
Pain.
If we don't treat the GB stone, what?
Well, the
what will happen?
cholecystitis could be make kind of pustules.
Sepsis?
Yeah.
Maybe.
Yeah.
Because due to the obstruction of common bile duct.
Cholangitis
Cholangitis.
or pancreatitis
Pancreatitis.
or
Liver damage is bad. Yeah.
gas cholecystitis.
Anyway,
Yeah,
it is
there
not
are
associated with gallbladder cancer
Not
Don't
usually.
judge.
If it,
Yeah.
well, if it's chronic, I think it's possible, but
because chronic inflammation continues. I think the cancer is
Maybe
possible,
possible.
but it is not directly associated.
Maybe
you know, it's not considered as one of the risk factors usually.
But was it a risk factor
For
for
well,
GB cancer?
well, we usually
Gallbladder is risk factor for GB.
we're talking about
cancer.
gallbladder cancer. Some special gallbladder diseases can cause a risk factor of gallbladder cancer, but I think chronic cholecystitis can be kind of mediated between, for example, parasites and gallbladder cancer. Maybe not. I'm not sure because we are doing a study of chronic gallbladder, chronic cholecystitis, not.
But as I remember, GB stone was one of the risk factors for GB.
Maybe you're right. I'm not sure.
But I don't think it's a direct risk factor.
Is it?
I don't.
You don't think?
if
check?
stones
We
continuous
can check now.
and chronic inflammation is presented, cancer is possible, I think.
This is all about memory, not about discussion. You can try look it up later.
Yeah. And there can be also gallstone disease.
Cholecystectomy.
Cholecystectomy.
I think the word. I like the word.
Cholecystectomy.
Cholecystitis?
Yes, it means that
The stones
there is
in
inflammation in your bile duct because of stone. So lithiasis stands for there's stone.
Stone.
So
it means the
Cholecystitis stands for bile duct. Bile duct stone.
Cholangitis.
Gallstone illness. Your gallstone was too big and it obstructed your bowel, so your bowel stops to work.
So this anatomy.
And,
In your abdomen, the right upper abdomen.
the
Yeah,
doctor
it is.
urinates into bowel.
Urine.
Looks like urine. He's urinating.
oh, it makes sense.
Sorry.
And gallbladder. And from bile juice, it comes from the
Juice.
liver.
That was juice.
But
Bile juice.
some bile juice
100% bile juice.
was stored in
Without
gallbladder.
sugar.
If you eat some meals, it was contracted and bile juice comes out from gallbladder to common bile duct to small intestine. So that's why the symptom of that woman in our case had a pain after
she's
being
dead.
ill.
She's dead. Was she dead?
High risk diet.
I forgot you
with
said.
high lipid content. And there is a pancreas. There is pancreatic duct, and these two ducts was combined in this area, and we call this area as a sphincter body, was the sphincter in the small intestine, and the common pathway we call it
Pancreatic.
What junction? What junction?
ankyloblatar. And if we have a GB stone in GB, it can come out from GB and obstruct. It can obstruct common bile duct to pancreatic duct, and the bile juice cannot come out from the common bile duct from liver. So if you have some bile juice retain this area, the duct will be more dilated, and also if there is a stone from here to there, and the pancreatic duct can also be obstructed, so it can cause pancreatitis. There is some gallstone disease, like this. Actually, biliary colic, we call it with as a pain, not actually a disease, but in this book, biliary colic was categorized was one of the diseases of gallstone. But we usually consider acute cholecystitis and chronic one, and cholecystectomy and biliary pancreatitis as a gallstone disease. And acute cholecystitis, we can find some three symptoms and lab values as auricular pain, and mild fever, but there can be no fever. And as a lab data, a little elevated WBC counts. And chronic one, because there is no elevation in WBC count, and no fever. But acute pain was persistent. And chronic cholestasis is a severe one because if you have a gallstone obstructed in the common visor, there can be the bile juice inside the biliary tree, and they can cause biliary sepsis, so it will be dangerous. So you have to diagnose this with some lab and other imaging techniques, and treat them immediately. We have to drain the bile juice from the PTVD or ERCP. Using that technique.
Bones inside pretty important.
There can be also really pancreatitis. Pancreatitis, we feel some epigastric pain. The pain will be reduced if you bend to the front side, because the pancreas is in the retroperitoneal space. So if you bend over to the front,
Question?
the pain will be reduced. And in summary cases, just 3 or 4 cases maybe.
And so maybe
It's
B.
an old woman present to emergency
4
department.
cases.
Really?
Let's sum it up. 65-year-old woman present to the emergency department with postprandial acute pain is easy, nausea and emesis over the last 12 hours. The pain is persistent and radiates to her back. She is afibulary, and her abdomen is tender to palpation in the IQ. Since sonography US findings are
Let's do ERCP. Hydration, antibiotics, and ERCP.
Laboratory study, WBC count was elevated, and AST, ALT, which elevated, which means there is a liver damage, and ALP was elevated too, and direct bilirubin was 4.0 milligram per deciliter. And so, what will you do?
So because it's it was contact.
Hydration and antibiotics.
Cholecystitis doesn't make sense because there's
Yes.
no gallbladder infection.
That's right.
Hepatitis is not.
The answer to the question number 1 is C, because we have to drain the bile juice immediately. And the question number 2. That's so.
That's the term sonogram.
Yeah.
Found
28 years old woman.
I mean, intestinal means frequent proteins associated with gallstones. So we can just follow them. Isn't it?
It's a B, right? I think
C.
C, deal with it later.
C.
E or C? Why?
C.
Inflammation makes the PPROM, so we have to surgery.
Here, you just there any evidence of inflammation or infection there? There, the patient has a skin digestion with biopsy. Just me, just me, just.
Maybe it could be, but in this case, the point was pregnancy. Maybe other symptoms can be induced by pregnancy, so we can wait.
Actually, the patient had no evidence of cholecystitis.
Maybe it can be cholecystitis, but
The patient,
She has no acute symptoms.
maybe it cannot. It can. It is not. Maybe it is not the cholecystitis. So we can, because it can be induced by the pregnancy. So we can wait for a while to be evaluated.
Just follow this, you know.
And question number 3. Which of the following findings is most consistent with the diagnosis of acute cholecystitis?
Not A.
C.
Whoa! Whoa!
I was paying attention.
Wow! You're great.
well, is there C the answer? C is the answer?
Oh,
It's
B.
Yeah.
First is
you lied to me.
Are you cured direct?
C is just about, just, it stands for, means that there's just some stones. It does not mean that there is inflammation or infection. If there are lots of stones in your gallbladder, it sometimes come out from gallbladder into bile duct and make kind of obstruction with pains, which is intermittent
C is just biliary colic.
because of stones. And A is cholangitis.
Actually, biliary colic is quite different from cholecystitis. So B is
Yeah. Answer is B.
Move to question 4.
And A is actually cholangitis. And how about D?
My presentation is about angry words.
Pancreatitis.
No.
Epigastric and back pain. Answer is B. B. B.
Choice A.
Which is like
more
their better
consistent with
pronunciation, B or B.
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 No, not B.
꿀벌.
B.
B.
Question number 4, the last question. 60-year-old.
Oh, she was
Red.
there.
With confusion of the medication.
Shows rectal temperature, scores
Wow,
volume,
lower temperature.
air, layer, trace.
Biliary, pre and lower.
C.
Whoa.
Because he presents with jaundice.
Oh yeah, he's shows jaundice. So the jaundice is caused by the obstruction of biliary trees. So not the biliary trees, come by duct or hepatic duct. So the cholangitis meets the that symptom. So the answer is A. And the patient was
One doesn't.
little older.
Okay.
This is for my presentation.
Oh.
Thank you.
You are prepared well.
Wow.